It is No Gifts Please, the parenting podcast by the pair with no real gifts, but a whole lot of gumption. Hey everyone, I'm Steve Noviello.
And I'm Jenny Anchondo.
And we are learning pronunciations today on the show.
Otolaryngology.
Well done. Do you know what it is?
Thank you. Ear, nose, and throat doctor.
I think it's just one of, I think it's two of the three, but we're going to ask our, I think I
ear
heard him.
and throat?
I think it's ear and throat. I don't think it's the nose part.
The nose adds the rhine in the middle.
Rhino something or another. There you go.
Yes.
For sure. So today's guest is, this is again in our continuing series of Jenny bringing in people here to get free advice about her own life. And also proof that you should really never talk to Jenny if you're ever invited to a party because she will make you come on our show.
I will be like, what are you doing on this random day when you're probably supposed to be working or being with your family and we want free advice? And you're Steve's friend? Come on.
Come on.
So we have Dr. Tyler Scoresby, a.k.a. my friend from Steve's party, who is an otolaryngologist, I hope. Okay, ENT and throat and all of the things. I just want to give like a couple quick credentials. Graduated BYU with honors. I mean, and then just like all of the medical school accolades. He treats people, this is, I guess, just particular for our Dallas audience, kind of all over the Metroplex. So there's offices everywhere. And then also importantly for our podcast, he has 4 kids ranging from college to 4th grade.
So your partner at Central Park, ENT, Arlington, Mansfield, South Dallas, and, most impressively, friend of the show, we'll call you. Welcome. Thank you.
Thank you very much.
How was her pronunciation?
She did fantastically.
Oh, well, thank you. Okay, now which portion of it is missing? Because I remember there was a longer version of the word, and I said, let me just get this one first.
It's all in the same order. Okay. Oto, ear, rhino, nose, laryngology, throat. Otolaryngology, if you want to say that, but just say ENT. It's fine.
Okay, that works.
So in Texas, apparently we have, this is good job security to be doing what you do in Texas because we seem to have an allergy problem here, don't we?
Absolutely. It's horrible here.
Why is that? So I'm from the Northeast. I'm one of those people who's I've never had allergies. It's never been a problem. My kids, in fact, we were together at a playground, remember, with Hudson.
Yeah. Oh, gosh,
and
that
all
was
of
scary.
a sudden he broke out in hives, was getting swollen up. We were playing in wood chips, which probably didn't help. And I took him to the emergency room because I was so worried about it. And then they said, is he allergic to anything? I said, I really don't know. And they gave him a bunch of Benadryl and maybe a steroid. And then that was that. Then a year later, same thing. And we went back to the same place. And the guy was like, do you realize that you were here almost a year ago to the day with the same child? Did you go to an allergist in the last 365 days? And I said, I really meant to, but I didn't.
I mean, obviously it makes sense that it would come back the same time every year, right? Yeah, so we're in pretty terrible territory from a humidity standpoint, from the way different types of pollen blow through us. We get summertime ragweed and wintertime mountain cedar.
Yeah.
So, we kind of get it hit all over. But there's a lot of mold from the humidity. So we're just in a bad alley.
Okay, so it's a good spot to do what you do.
Exactly.
Because you need all these offices, you've got all these patients, if somebody gets to you, is that after they've already done immunotherapy or the allergy shots, that sort of thing, and it doesn't work, then they get to you, or would they possibly come to you first?
Well, as an ENT, you can kind of hit both angles, right? And so mostly it's a primary care doctor sending it to me, not an allergist. Okay. Allergists, if they wanted to do immunotherapy, that's fine. But the nose has a combination of medical and surgical problems, right? So if we're trying to tease out the pure allergy stuff, we're talking about itchy eyes, runny nose, congestion. But then there's the surgical stuff also, where there's fixed obstructions, like a deviated septum or big turbinates or big adenoids. And so we do immunotherapy like an allergist, and then we have the surgical stuff as well. The immunotherapy, I think, can be done either place, but they typically don't, an allergist who's doing immunotherapy isn't typically sending them to me for allergy treatment. They're just going to do it themselves.
How often does the allergy treatment, the immunotherapy, not work? How often do you have somebody who's been coming for 6 months and there's no improvement?
It's rare. Well, 6 months is pretty short, actually.
Oh, okay. Well, talk about the timeline then.
Yeah, well, so the way I think of immunotherapy is, let's say you have kind of 2 levels. You say this is your set point at which you're going to have a reaction, right? And then if you're exposed to this much allergen, you're going to have a reaction, right? allergen meaning pollen, most
Right.
of that stuff, right? So we want these to be far apart from each other, right? We want your threshold to be high and your amount that you're exposed to low. And in Texas, you're not going to do a whole lot about the amount. There's some indoor stuff you can handle, like dust mites and pets and stuff like that, that can keep your level low. But immunotherapy is like raising your threshold, along with medicines, antihistamines, nasal steroids, all that kind of stuff. But it's like you have to bump this threshold up slowly. The immune system is kind of touchy, right? It's like an overprotective parent. Well, I was going to say mother, but
we're in mixed company, Tyler.
So an overprotective parent, right? So this, it's always trying to protect you from pathogens, and usually it's doing a good job, but it thinks of all these pollens and stuff as pathogens, and so it's creating a reaction. And so the reason immunotherapy kind of takes a while to work is that you can't aggressively bump up really fast because your immune system get angry.
Right. It's got to develop a tolerance.
Yeah. So like we test you, we find out what you're allergic to with a whole bunch of skin pricks, see what reacts. And then we take all that stuff, dilute it to a point where you're not going to have a reaction when you get a shot, because we don't want to make the immune system more angry, right? We want to buddy up to it. We want to like get below its reaction threshold and then slowly bump it up. So depending on how bad your allergy test is to begin with, it may take 9 to 12 months for even to start, right? Because we don't want to have a reaction, right? So we're trying to get all the way up to fully concentrated levels,
right? With no reaction.
So I owe an apology to my daughter's allergist. I marched in there at the 6-month mark, which was totally arbitrary. I don't know why. 6 months was that was my prick point.
That was your medical opinion.
This is ridiculous. She is not getting any better.
Well, and then there's that question of what is your daughter's actual problem, right? Like, yes, she has allergies,
it's
right?
Overprotective mother. That's the problem.
But it's are you talking about the itchy eyes, runny nose?
Runny nose.
Okay, so not congested.
Yes, and congested.
In fact, she's here, Tyler, if you wanted to give her a quick exam.
United Healthcare.
Since you're here.
Did Hudson end up going back, or?
We have not gone to an allergist. I feel like we need to.
It's like a one-time thing.
But what we do is we give them children's Zyrtec every night, which I don't know if I'm now developing an immunity to that because we give it to them so often. I don't know.
Some people think that if you rotate through the different antihistamines, it's helpful.
Right.
I don't know that there's any solid data around that, but a lot of allergists will tell you to use a different one once, every month.
Kind of like pre-workout, right? Like you want to cycle on and off.
Again,
right?
Yeah, you're trying to build your tolerance.
Okay, here's my question though for people that are tuning. The idea that one would develop allergies, is that a thing, or is it you either have them or you don't?
Well, for sure. I mean, again, the immune system, it can be taught, right? So just like how a vaccine works, all this stuff, it can be taught. And so as you get exposed to something, you're probably not having a reaction that time. The next time you're exposed to it, it'll be a little bit more. The next time you're exposed to it, it'll be a little bit more. So people tend to develop them over time. Like infants to 2 to 3 year olds probably don't have allergies. Their congestion and stuff probably is viral, right? It's because it takes time for your immune system to, a yearly cycle to kind of get exposed to this next pollen,
Do you ever hear it from parents, Steve, where you're meeting up with a friend for a play date or something, and the kid is just the nose is so runny, they're and the parents don't worry, it's just allergies. And I always wonder, how do they know that? Because they're trying to let you know, hey, my child's not contagious, they can still play.
They're not going to give you anything.
How does one know if it's allergies or sickness?
Honestly, it's hard to tell, right? You don't always know because they produce similar symptoms. A lot of times it's about the timing. If you've had this runny nose for a month, it's probably allergies, right?
Okay.
If you've had this runny nose for 2 or 3 days, and it's getting gross or greenish or whatever, it might be something else. And you don't always know, and we treat them kind of the same way at first anyway, right? You're not going to throw an antibiotic in the first 3 or 4 days. We treat them with antihistamines, nasal symptom relief at first, both of them, just to control the symptoms and see what happens.
But the key word was green. I heard you say green. Like, is that true? Like, green is maybe keep them away from other kids, or
again, it's hard. There's no solid line at which it's an infection or it's allergy.
Actually, it's funny when I go to, because I'll get like bronchitis generally once a year.
Yeah.
And I will always take a picture of my phlegm with me when I go to the doctor, because they always ask, well, what color is it? And I'm like, I've got a photo. Like, here you go. And they'll take a look at it. And depending on if it's yellow, brown, or green, they'll be like, oh, well, we need to proceed down one of these 3 avenues.
You're like, don't worry, I'm a journalist.
Don't worry, I've got proof.
Documented. Raul took a video of it. Here's me hacking up a lung on camera. I think it's just very complicated to know, because you don't want to send your kids out when they seem like gunky.
Yeah, and I agree with that. I mean, obviously you don't want everyone getting sick from each other, but I also, I'm a parent who tends to let my kids explore and experience, and I think the immune system probably is worthwhile doing that with as well. You know, so not that you want your kids sick all the time, but you know, overprotection from that stuff sometimes is not the right thing. Your immune system is supposed to learn how to do that.
Mm-hmm. So when people are coming, so allergies is kind of one portion of what you guys are doing. What is the rest?
Well, the surgical part,
right,
for example, is like, I mean, ENTs do a lot of stuff, right? But if we're talking about the nose symptoms, right, entirely nose, then we're talking about immunotherapy, you know, optimizing medications. There's like, you know, 3 main classes: the antihistamines, nasal steroids, something called leukotriene inhibitors. You kind of adjust medicines based on symptoms, but then you kind of pay attention to, are we talking about obstructive stuff as well? And can I improve this person's runny nose by taking their adenoids out? That's if like they're really chronically infected, or if they just can't breathe through their nose most of the time. Sometimes I'll be, you know, told by a parent they have bad allergies, and I'll look in there and the front of their nose looks fine.
Okay.
You know? Then we have to assume, or take an x-ray or something, that the adenoids are probably the cause, right? The front of their nose looks great. It's not swollen, but they're having trouble breathing. It's probably further in the back. And so, you know, you have to tease that out when you're talking to patients and figuring their exam out. You tease out the obstructive part versus the inflammatory part. Have you read,
I was just reading this the other day, that the FDA is backtracking on the effectiveness, I think it was of certain antihistamines. Am I the only one who heard
that?
This
is ringing a bell, but I don't know. There's
an active ingredient maybe in like Mucinex or whatever else it is, and the FDA said, well, it's still safe, but oh, by the way, it's not nearly as effective as we thought it was.
It's the phenylephrine. So that's the decongestant. Yes. Okay. And so there's the pseudoephedrine that you have to get behind the counter because people make meth out of it, right?
That's the good stuff.
And that actually does work. But it also, you know, raises blood pressure, raises heart rate, all that other stuff. So I don't like to put people on it too much. The phenylephrine was the one that they said was also a decongestant that was in the over-the-counter stuff without the pharmacist. And yeah, they said that doesn't work, which in my experience, it doesn't.
You're like, I could have told you that a long time ago.
It's just so interesting that, like, I mean, for decades, that has been, I mean, phenylephrine came around in like, I think it was the 70s, maybe. I mean, that's 50 years ago that we've been like, oh yeah, sure, take this. And it's like, oh, it's actually nothing.
Same thing. I mean, if a medicine's not really hurting somebody, you're not, and it's over the counter,
right?
You know, it's not going to be necessarily pulled off the market just because of lack of effectiveness. You know what I mean?
Yeah. I was thinking more of like just in terms of like the hundreds of millions of dollars that consumers have wasted over the years, taking something that apparently could have been grape juice and it would have the same effect on it.
Deviated septum. I had only ever heard of this when people back in the day were getting a cosmetic procedure and it was called a deviated, like it was like, I'm fixing a deviated septum. I never knew that.
And by the way.
And then all of a sudden they looked like so amazing and I was like, wow, cool. Like I want a deviated septum. Anyway, now I feel like cosmetic surgery it's not as like taboo. So people don't say that as much anymore. But what is a deviated septum actually?
I mean, you're totally right that I think that was social cover, right? For rhinoplasty, which is really more the exterior part. The septum is just this piece that goes down the middle, right? It's a piece of cartilage that runs and bone that runs this way. So deviation just means that it's like curved off to one side. So typically the presentation would be one-sided obstruction. In most cases. Sometimes it's wavy or whatever, but usually it's one-sided obstruction.
How do you fix it? You go in there and shave it down or what?
So For a septoplasty, you don't have to make any real exterior incisions, right? You just make an incision on the inside, lift that lining up, and then, a lot of times you're just pulling out pieces that are pushed off to one side. I know it sounds scary, but this is all inside your nose. There's you're never going to miss it. I mean, there's pieces we have to keep or replace or whatever, right? But there's a lot that you don't need. So if that's the part that deviated, you just pull that part out and close it up.
But then people sometimes look a little bit better because it's like straighter.
Well, no.
Not really.
Or because it's like you're already under anesthesia. So let's just like do it both. Do it all.
That's where that's where we're talking about more like a rhinoplasty, like the exterior stuff. And sometimes, some insurances will cover that.
Since you're in there anyway.
Well, no, not really. Not really that. But if there's something really visible that is causing obstruction.
Gotcha.
It takes some effort to get that approved. Usually that's not covered. Because it's generally cosmetic.
Yeah.
The interior stuff is what's covered.
But nice to be able to just be under once in one recovery.
Oh, yeah. And for sure, if you wanted a rhinoplasty, you would not want to do a septoplasty on its own first. And the reason for that is that if you're reshaping anything on the outside, you have to get cartilage from somewhere. And since I'm taking part out anyway,
right,
then you use that stuff, right? But if you've had a septoplasty and then try to go to a rhinoplasty, you don't have as much to work with, in cartilage, right? And so you sometimes have to get that from somewhere else, like your ear or a rib.
You don't need a nose job.
No, you don't. Your nose is perfect.
Right? This is just like general information. I actually used to always want one, but I've outgrown that. Now there are other issues. Like now it's like, we've got bigger fish to fry here. Like that's the least of our worries. But
you have a really nice nose.
You do have a perfect nose. I would not mess with it. Yeah.
Thanks, guys.
I mean, Tyler has got scrubs on and everything. And
I know. And I lured him here under false pretenses to do this podcast, but I had all these selfish questions. Okay, I want to talk about tonsils being removed. I feel like everybody's getting their tonsils removed. Our kids are like in that first, second grade arena. Is that kind of like when it comes to a head for everybody? That's
the peak time probably.
Okay.
But there's two good reasons to take tonsils out. One is, are they so big you can't breathe around them? And that's usually manifested in sleep.
Okay.
So I'll ask a parent to pay attention to them while they're sleeping. If they're snoring really bad and stopping, okay, so that's obstruction, right? There's one good reason. The other reason is recurring infections.
Like tonsillitis?
Yeah, recurring strep or, tonsil infections. So if they're getting antibiotics several times a year, that's probably an indication to take the tonsils out.
Okay, so this may be a dumb question, but they can be removed, obviously. What is their function that they're so expendable?
Okay, so good question. So the adenoids and tonsils are part of the immune system. Okay, so like they're the same tissue as kind of lymph nodes. Lymph nodes are places where your immune system is exposed to all these pieces of virus and bacteria, and it says, "Hey, go look for this." To your white blood cells, go look for this stuff. And so the nose and mouth is a good place for that, right? So it's a good place to pick that stuff up. And in most people, they work great. But if they get so big they're obstructing, there's plenty of backup. I mean, there's a whole bunch of other lymph nodes that do the same thing. So you don't need them necessarily to prevent illness, to like make your immune system, it's not going to make your immune system worse.
Right. There's a redundancy built in.
There's a redundancy built in. So but that's what they are. They're part of your immune system. They're teaching your white blood cells what to look for.
Huh. I don't have any tonsils myself, so I guess.
Oh, were yours taken out?
Because of strep throat all the time.
Doug had his taken out as an adult. I remember we were.
As an adult. I was thinking I should take out Heath's too because of the snoring.
You know what? I venture to say it does not help. It does not.
Okay.
Well, maybe it helped, but it certainly did not solve that. I mean,
Doug got it out for strep though, or for obstruction.
Tyler, it was a busy time in my life. I don't really remember specifically, but I do remember they went in, they burned them out of his throat, or however they do it.
It's not. It's a super easy surgery to do. It's a super difficult surgery to get over.
Yeah.
Right? No one likes how people really don't like me for those first 10 days.
But it doesn't cure snoring.
Oh, 10 days.
Well, it depends. Okay, so it depends. It can help with snoring, but that's not in kids, really, that's where we're talking about that. Because most tonsils get smaller as you get older. Okay. So they don't obstruct so much. There are other things we can do for obstructive sleep apnea in adults, but typically, in kids, it usually is the tonsils and adenoids that's the cause of that. So I don't know why he got his tonsils out, and I'm sorry.
Neither does
I'm sorry.
Steven.
He still snores, but there are a few options around that.
He's fine. He's fine. But is it because we're all so much more connected that it seems like so many more kids are having their tonsils removed, or is it actually a thing?
Yeah, I mean, well, I think there's actually a lot less kids getting their tonsils out.
My unscientific study of 5 people I talked
exactly.
to.
You guys have
over here.
you guys have prime age kids, right? So like you're seeing it, right? That's your sample set.
Sure.
So, but yeah, I mean, they used to take the tonsils out almost
drop
routinely. Yeah, it was like, oh, you have tonsils? Let's get rid of them, right?
Okay.
We, over time, just because it's so painful. It's not like super dangerous, but it's so painful afterwards. We want to do them in the right people, right? We don't want to put someone through that unless we're really going to help them. And so, our academies have really set up, really clear criteria for when it's worth it, right?
Okay.
In terms of number of infections and all that.
Are there any key errors that you find that parents are making when it comes to addressing ear, nose, and throat issues with their kids, or misconceptions maybe that they come to you with, where they're saying, gosh, common knowledge is this, and you're like, actually, that's a big misconception when it comes to this kind of health?
I have people coming in both directions where it's like, they've been told all this time that it's allergy,
right?
And it's not. It's obstruction, and we need to do something else.
So if somebody's not what you are, and they're going to somebody that just does like the immunotherapy, they've never been able to see what you can see with your equipment. Right.
Now, and I will say, like, so I do allergy as it relates to the nose, right? Yeah. The other stuff that I do. An immunologist, they do broader stuff, skin reactions, asthma, that kind of stuff. So like there's kind of two routes you come to this. There's the medical route. Those guys do immunotherapy. Like internal medicine followed by an immunology. We do this surgical stuff and then kind of add on the allergy stuff as an adjunct to what we do.
I totally interrupted your sentence there too. I apologize.
No worries. I don't even remember what I was talking about.
I'm excited about your train of thought there, where it is like it's the two different routes, and I didn't even realize that there's like the two different ways you can go.
Well, and I think that it speaks to making sure that you're going to people who are an expert in whatever it is that you're looking for. I mean, if you go to somebody who, only sells shoes, he's not going to sell you a hat, right? I mean, you got to, even if your problem is you need a hat.
Yeah, I mean, if someone comes to me and starts talking about asthma, I tell them, you know what, I'm not your guy for that.
Yeah.
I'm going to refer you out.
Right. Give me your tonsils.
Yeah.
I'm here for your tonsils. Okay, where can people find you? You guys have a website, or so Central Park is at, we've got a whole bunch of different locations.
A bunch of different locations. The main one is in Arlington, but we have satellite offices in Fort Worth, in Denton, in South Dallas, and Mansfield so far.
And the website is?
centralparkent.net.
Cool.
Excellent. Dr. Scoresby, thank you.
Happy to be here.
That was fun.
Appreciate you being here. Okay. Did you want to ask if he takes your insurance before he leaves?
I already did. I slipped it in the episode, actually. I already did. But it is interesting to see now, because I feel like now with kids, you're just navigating like you're going to a gastroenterologist. I don't know if I said that right.
So it sounds to me like you're navigating with Brighton specifically, some allergy issues?
Yeah, but we've been, like I said, getting the shots for 6 months, and I just burnt out on it.
But now now
I know I need to just keep going.
So did you cut it off after 6 months?
No, I just might have embarrassed myself a little bit by being like, what are the expectations here?
Well,
but I just, it's like, you got to hold somebody accountable. But they were like, you don't wait a year. They said sometimes it takes a year. So I was like, okay, well, I just needed that expectation up front that, hey, we're going to be coming in here every week for a year, which is very difficult to do, but worth it if it's going to help her.
Well, but I think that also
we don't do like Zyrtec or anything. Right.
But that's the responsibility of the professional. It's like when people come to us and we're like, oh, we do this every day, blah, blah, blah. And they're like, what should I wear a pattern? Should I not? Where does the mic go? Like, who do I look at? And it's like all these, whereas that person should, again, set the expectation of, hey, listen up, you're not going to see results for X amount of time.
Right. And no patterns, in case you're wondering. Unless you're me with these stars.
I love it. Okay. Good information. We'll put it in the episode notes of exactly where you can find Dr. Scoresby. You can find us every Tuesday morning when a new podcast episode drops on your favorite podcast platform. Be sure to click like and subscribe. And if you do nothing else today, go find yourself a friend you don't need to clean the house for. We'll see you soon.